WIC is not just about, the stereotypical nutritional vouchers. They have classes here. They teach you the importance of breastfeeding and really bonding with your kids and your family in general. We also have Healthy Start. It's just a combination of resources and ways to have a healthy family.
I first heard about the WIC program when my sister was on in 1994 when she had her baby.
I found out about the WIC program through the doctor's office when I found out I was pregnant with my daughter, the oldest.
When we took custody of our grandson, he was an infant. So we needed some help with the formula because it was an unexpected expense. WIC was really helpful in that aspect for us.
Income, the way that it is now, we're struggling with the economy. They really help us with everything that we need assistance with.
The staff, from the time you walk in, they're kind and courteous. They understand that we need that little extra help.
The best experience for me is the staff is amazing and they're so nice and they help us in any way they can.
It's helped me because I did learn portion control, things about how to brush her teeth, things about how much juice she should have.
They have helped me with a breastfeeding course with my new child. They helped me through everything to make sure that I was going to stick with it and that this is what I wanted.
I think because they offer such a great support system, when we've had some problems with getting him to eat a variety of foods and introducing new foods, they've been real helpful with suggestions on how to encourage trying the new fruits and vegetables.
My first nutritionist, I will never forget her, she's retired now. She gave me all the information that I could ever have wanted. I didn't even think about asking, or that I didn't even know the WIC program actually provided.
They go out of their way that if somebody needs some extra help, they have resources that they can give you contact information.
If I was describing the WIC program to my best friend, I would tell her that I love it, that she needs to do it, if she's available to do it and they feel like family.
Yeah,
family. They treat us like family, just like a family would. My family anyway, they're very nice.
I would have to say that the WIC program is definitely a beneficial program. Not only does it provide nutrition, but it gets you through.
It's been a long time since I've raised a child, so everything's changed. It's really helped with coming up with new and creative ways to encourage healthy eating.
It's not junk food, it's things that we need and things that you can live by. And I think that people have a negative connotation towards it. It's not welfare. It is a supplemental program to assist you.
So not only do they help me with resources and ideas for encouraging Cohen to eat healthy choices, but they've actually helped me.
There's no judgment. Even though you may be overweight, underweight, they're there to fix that in the most positive way. Never judging, never criticizing. For me personally, it's an extended family. Being a participant has really opened my horizon to the value of fresh fruits and vegetables, healthy foods that you normally wouldn't freely choose yourself, but by having them tell you what to buy. Not that I'm saying that they're forcing you to buy this, they're just there to guide you in the right direction.
WIC, they worked with me being a vegetarian, helping me pick out the right foods, and knowing my diet, the way I needed to eat while being pregnant.
It has been a huge help with, giving me foods and list of foods to ensure that both me and my son are getting the nutrition we need.
The foods that they give are the foods that we should be eating in the first place. You can't go and you buy junk food. The fruits, I never knew that my daughter loved oranges like she does. I love the farmers market checks. Coming in from the local farmers around the area, I've picked up orange cauliflower, golden beets, stuff that you won't get at the local grocery store.
Over the last several decades in this country, there have been really great strides in improving breastfeeding rates, both of exclusivity and of duration. However, what we see really is that most of the gains have been made early on with initiation of breastfeeding, and that there are still significant drop-offs in the first 3 and particularly 6 months for duration in general and specifically for exclusivity, both of which we know are critical for the health of the baby and the mom. There are lots of things that we can do, we know from evidence-based, to improve these rates.
We saw that women were struggling to meet their goals. They were also having problems with they're worried about returning to work and being able to breastfeed at work. So we wanted to support our WIC staff in providing great breastfeeding counseling, and we also wanted to support our businesses into creating breastfeeding-friendly environments for these women.
A lot of our participants do have to go back to work pretty shortly after their baby is born. The policy that was put into place has been really helpful with employers being more open and more aware of needing to provide space and time for our breastfeeding participants.
Here in Virginia, we have a number of different initiatives to create breastfeeding-friendly environments. We have an initiative working with the hospitals, and so the next domain is really the workplace.
We had several employees who were out on family medical leave for the birth of a child, and that prompted the need for us to start looking at ways to accommodate these employees as they come back into the workforce. We worked with the health department in creating a comprehensive lactation program for all county employees.
A lot of moms don't have an adequate place to pump. They're having to pump in a break room, in a utility closet, or their car, or going to a bathroom. You know, a public space, which is not ideal for breastfeeding. Breastfeeding is a very personal, intimate experience, and if you have to do it in front of a group of people, let alone your coworkers, sometimes the barriers are so great that moms give up in the first place. It's not really worth it to them.
I gave birth to my daughter last year in May, and then after returning from maternity leave, I was happily surprised they had just opened the lactation room. I came back with very low anxieties, not having to be concerned of where I was going to find a place, how often I was going to be able to pump. In turn, that equated to being able to breastfeed for a whole year. It really takes a lot of the guesswork of coming back to work and being a breastfeeding mom.
So what's next is we have to empower our moms and our WIC moms to advocate for themselves and help transform the businesses they work at to be breastfeeding-friendly workplaces. We have toolkits that help their businesses easily implement policies, easily develop practices that support breastfeeding moms in the workplace. And we were able to do that through this grant through the National WIC Association.
Historically, healthcare providers have had little to no training in breastfeeding education and support. And the second piece of it is that they really need to know how to integrate breastfeeding practice into their current practices to be able to make it sustainable. So here at the Loudoun County Health Department, we created a toolkit for healthcare providers in our community to address some of these gaps that we had identified in both knowledge, attitude, practice, and actually practice management. So we've been able to distribute these to all of our healthcare providers who provide care for our babies in our community.
We know that mothers who breastfeed are going to have less lost time at work because their children are not going to be as sick. They're also going to have more satisfied employees. So there's a whole list that supports why a business should do this.
We have been working on the idea of spreading the word about breastfeeding awareness, as well as supporting not only our patients here at Loudoun Pediatric Associates, but also our employees who are nursing mothers.
We recognize the importance of ensuring that mum has an ability to provide the absolute best nourishment and nutrition to this little boy or little girl that's just joined us in the world. Being a healthcare provider, we're very, very sensitive to making sure that mum has an ability in terms of her shift and her flexibility. Private rooms, the ability for mum to express while she's here on the job and still continue working remains really, really important for us.
The partnership with the Loudoun County Health Department has meant a lot to the Loudoun County Chamber of Commerce, especially the ability to integrate the breastfeeding program into our Health and Wellness Challenge. That's always been about helping our members institute wellness programs for their employees to ensure their wellness, their productivity, and also as a retention tool for them too as well. So it's really provided an additional resource that has made the Healthy Business Challenge better than it's ever been before.
I think that becoming a breastfeeding friendly workplace is something that pretty much every business should be able to do. It didn't cost us any money, and it only makes it better for the staff and for people that are coming in to your place of business.
We think that this is just the start, really. Our 20 businesses and our county can be a model for other businesses in our community and statewide to be able to implement these very simple practices that we know can have such dramatic improvement of health for the children of our community.
Supporting WIC and supporting their breastfeeding initiatives is so important because this is the health of our women, the health of our children, and the health of our infants. The future of our nation literally relies on the health of our pediatric population. So if we can help infants get off to the right start with exclusive breastfeeding, then we are setting ourselves up for a successful and healthy future.
We have a program that's called the Healthy Lifestyle Prescription, and we have now 8 different physician practices that are using these prescription pads.
We started this Healthy Lifestyle Prescription Pad as a way to get in touch with our patients, talking about some of the non-pharmaceutical options that they can use to help improve their health and overall well-being.
Prescription pad is specifically to encourage healthy living habits for their overall health, like exercise and eating well, and then the Change for Change program, events like this, JC's Race, stopping smoking, and then the prescription pad refers them to a website, which is the bcch.us.
Promoting healthy eating and exercise is a big part of our pregnancy education that we provide, as well as just general health. The Healthy Lifestyle RX is a way to jump off into that and really get the pregnant mom some information on how to eat healthily and how to exercise more.
We have a program in Sandpoint called JC's Race, and it's to benefit other kids. And many physicians are telling their patients, I want you to train so that you can walk in this program.
I participated in JC's Race as a way to be a part of the community, and thinking about all these different community programs that are available has given me more information to pass on to the patients.
I do have some clients here today. One of them is a pregnant mom. She's delivering in a couple weeks. She had kind of had a pretty significant early on weight gain. We had talked about at our last appointment that she was going to work on walking in the evenings, and then she saw the JC's Race and decided that she would participate along with her 6-year-old.
Now I'm seeing that all these things are available, and a lot of patients just might not know that they're there. So we were able to really consolidate all of this information together, get it on the Healthy Lifestyle Prescription, but also just give us a chance to learn as clinicians what the programs are, how do we get them to our patients, and how do we get them outdoors getting healthier.
The WIC program is like family. Just a loving atmosphere when you walk in the building. It's like they're always willing to help you with anything you need.
Well, I love this clinic because everybody knows us. Like Kenzie loves everybody here. Like she has a smile on her face and everybody knows us by name. I think the foods are awesome. I mean, you get bread, you get fruits and vegetables. It helps the kids stick with the safe stuff.
Okay, the red beans and rice that I'm cooking is my mom's recipe. It's beans that you get on WIC. It has onions, green peppers, seasoning. The WIC office actually provides farmers market vouchers. Lacey has a lot of fun coming to the farmers market, and she can help shop and put the vegetables and the fruits in a basket.
WIC does not cost moms anything whatsoever. So WIC ideal is just to try to take foods that are very simple and use them in different ways. It has always been one of the miraculous things when it comes to medical to me, that you can just do something as simple as changing from fried food to baked food and change your whole outlook on your health.
A lot of people have a misconception about what WIC is. They think you just come in here and get the vouchers and that's it.
but of course it's based on nutritional needs. We actually do nutritional assessments on women, infant, and children.
With WIC, we're providing you with those basic tools to be able to build on them. We want our families, even when you're off of the program, to sustain those healthy choices.
I can say this WIC program helps a lot. When we have the new babies, I try to wash bottles and whatever I can do to help to make it easier for her because she's got a job.
I think WIC definitely teaches the dads that moms don't know it all and we can't handle it all, although we try to, but we need you.
I got a lot of help from my caseworker at WIC. The way she helped me was she educated me as far as what to eat, what the benefits of breastfeeding my child would be, all the nutrition that I would have to get for me to be able to breastfeed.
It's gonna be their choice. If they choose to breastfeed, again, the support is gonna always be here. We're gonna be the extended family that they can always count on. Breastfeeding, I would say, is the most thing that you can give the baby. If you want to spoil your baby, do breastfeeding.
It's more than about food. It's about creating relationships. It's about self-advocacy. It's about getting our families to sustain a process of eating healthy and being healthy. Starting the organization, and I just knew how important it was to make families feel important when they walk through the doors and then embrace them into our organization and have that effect of a family.